Hello everyone. So today we will learn about the condition called Parkinsonism, in which I will mainly throw some light on clinical features of Parkinson. So yes, let's start. What is Parkinson? Parkinson is a neurodegenerative disorder in which both motor and non-motor symptoms are present. The rate of onset of Parkinson is generally insidious with slow rate of progression, and it is a chronic condition. It occurs due to degeneration of dopamine in basal ganglia. So now when we talk about the incidence, it is the average age group in which Parkinson is seen is between 50 to 60 years of age. But there is also young onset Parkinson, in which the age group is 21 to 40 years, juvenile Parkinson below 21 years. But the young onset and juvenile is not so common. Okay. So now we see the types of Parkinson. There are three types of Parkinson. First one is idiopathic Parkinson, which is genetically determined. Second one is secondary Parkinson, in which there comes like toxic Parkinson, that is due to the industrial chemicals. Then the second one is post-encephalitic Parkinson, in which slow induced virus affects the CNS of the brain. Third one is drug-induced Parkinson, in which a drug affects the extrapyramidal system that mimics the sign of Parkinson. So yes, these all three, post-encephalitic, toxic and drug-induced, that all comes under secondary Parkinson. Now the third one is Parkinson plus syndrome. It is a group of neurodegenerative disorder that is present along with the Parkinson symptoms. Examples include Alzheimer's disease, multivascular infarct disease, juvenile like Wilson disease. Okay, that is all example. Now when we see about the clinical features, there occurs rigidity. When we examine, we will commonly see that there is rigidity present. Rigidity is also like defined as heaviness of the limbs. Okay. Now as we all know, there is two types of rigidity: cogwheel rigidity and lead pipe rigidity. Cogwheel rigidity is like jerky movement throughout the range of motion, and lead pipe rigidity is sustained resistance throughout the range of motion. Okay. So we also see tremors in the Parkinson patient. Tremors are again of three types. Resting tremor. Resting tremor are tremor that is present at rest, and it is like it disappears during activity. Second one is postural tremor. Tremor that is present at head and neck of the patient. Third one is action tremor. Action tremor is tremor that is present only during action. When patient do some action, it disappears during rest. Okay, so these are all types of tremors. So yes, when we talk about the posture, the Parkinson patient has kyphotic posture with hip and knee flexed. When we talk about the gait, Parkinson patient has gait which is termed as fascinating gait, in which bradykinesia is present, in which patient has difficulty initiating movement, and patient when walks take multiple small steps and walks with like kyphotic posture, hip and knee flexed and reduced arm swing. Okay, patient also has difficulty during turning and initiating a movement. Okay, so yes, then there is also postural instability present, like patient has difficulty during like self-initiating movements, like during like functional reach outs also. So during sit to stand activities, all are that occurs postural instability. Okay, so yes, when we see the writing of the patient starts writing like normal writing with normal letters, and gradually the letters become smaller and smaller. This is called as micrographia. Also, when we look at the speech of the patient has monotonous speech. In monotonous speech, we generally we generally get idea from the term only, monotonous. Mono means same, tonus means tone, same tone, that there is no high pitch, no low pitch. Like for example, the patient talks like that, my name is XYZ. This is how the Parkinson patient speaks. Okay, so this is called as monotonous speech. Yes, from observation we see that the patient has masked like face. There is no expression of happiness, no expression of sorrow, no expression of anxious. Okay, so it's a masked like face. Okay, so these, when we talk about the non-motor symptoms, in non-motor symptoms there is dysphagia, there is anxiety, depression, hallucination. Okay, insomnia is present. These are all non-motor symptoms. Constipations are present. Okay, anxiety, depression, these are all non-motor features we see in the patients. Okay, so this is just about the overview of clinical features of Parkinson condition. Okay, so yes, proper assessment and proper treatment plan is must while we are dealing with the Parkinson patient. Showing empathy to the Parkinson patient, listening their history, they are all just main background when we deal with the Parkinson patient. Like when we plan the treatment protocol, we should first make short-term goals, long-term goals, and then accordingly we plan our treatment. So yes, this is about the overview of the Parkinson condition. Okay, thank you.